Today we are reporting 425 new cases of COVID-19 in British Columbia, including 4 epidemiologically linked cases, bringing our total number of cases to 16,560 in British Columbia. And for today, starting today, I'll report on the new cases by health authority. 126 are in the Vancouver Coastal Health Authority, 268 people are in the Fraser Health Authority, 7 people are on Vancouver Island Health Authority, 8 people in Interior Health, and 6 in the Northern Health Authority. We have no new cases in people who normally reside outside of Canada. We now have 3,389 active cases in all health authorities in British Columbia, of whom 97 people are in hospital, 24 of whom are in critical care or ICU. We have had no new deaths in the last day, leaving our total at 273 people who have died from COVID-19 in BC. We now have 7,519 people around the province who are under active public health monitoring, and 12,806 people who have now recovered from COVID-19. Just to put in perspective, we have now, in the last 24 hours, the cases that we're reporting are from 11,020 tests that were done at labs around the province. That gives a provincial percent positive of 3.8%, again, a rise from what we have been seeing in the last few weeks. We have 2 new healthcare facility outbreaks at the Tabor home. This is the second outbreak at that facility, and Pine Grove Place in Fraser Health. And 1 outbreak has been declared over the Queen's Park Centre Care. That leaves us with 30 active outbreaks in our healthcare system, 28 in long-term care and assisted living, and 2 in acute care. We now have 1,118 people in long-term care have been affected, including 648 residents and 482 staff members. There have been no new community outbreaks, although we continue to have ongoing clusters in workplaces and other venues around the province. On the positive note, the outbreak at L'École de l'Ensable in Kelowna has now been declared over, and students and staff will be back in class tomorrow. And I just want to extend my thanks and appreciation to the family and the school officials for their assistance in working with Interior Health to manage this challenging first outbreak that we had in a school setting. And I'd like to take as well this opportunity to remind parents about the importance of keeping our schools open and making sure we keep our social contacts small. This includes birthday parties with children outside your household, sleepovers with classmates, and I know this can be difficult and challenging for children, but I ask that you look to celebrate in smaller, other, safer ways right now. And a reminder as well to continue to check health authority websites for community and school exposures. There continues, as we all know, to be strong interest in the latest data of the pandemic that we are experiencing here in British Columbia. And next Thursday, we will be providing a data modeling update and continue to do so as we have in the past on a periodic basis going forward. I also want to mention that the BC CDC has set up a new COVID-19 epidemiology dashboard for those who are interested, which shows what's happening in British Columbia compared to other jurisdictions in Canada and globally. Some of that information we've presented in some of the data presentations we've done in the past, but this is a dashboard that will be updated and publicly available twice a week on Tuesdays and Fridays. At the BC CDC COVID-19 data page, and it shows cases and testing information together, which gives you a sense of a more accurate picture of the state of the pandemic in each given location. So what it tells us is, for some places, there may be a very high testing rate and low numbers of cases, which shows us that many people may not be tested. For example, 2 countries could have the same number of cases, but a very different epidemic status if one country is testing a lot and the other isn't. So it's a way to help put what's happening to us, with us here in British Columbia, in context for people, for those who are interested. As we learn more about COVID-19 over the past number of months, we've been able to adapt our daily activities and continue many things in our communities around the province in a safe and responsible way. This is important for our overall mental, social, physical, and economic well-being, and a key goal in our COVID-19 response, to minimize the impact of this virus, both on the health system, on us individually, but on our communities. We've also adapted the guidance we have provided as our knowledge and understanding grows. And while I would like to note that while some recommendations change, the foundational layers of protection and the minimal but important province-wide orders that we have in place are our steady guideposts. There are some things that have not changed. That includes the basic measures that each of us as individuals need to take to make sure that we're doing our best to prevent transmission of this virus. And if I've said it once, I've said it many, many times. That's cleaning our hands regularly, making sure we cover our cough and not touch our face, keeping our safe distance, particularly from people we don't know if we're out in public spaces, and when we can't do that, making sure we use that extra layer of protection of wearing a mask when we're in indoor public spaces in particular. These orders that we have as well around gatherings, around situations where we know transmission has been in place, will continue and will continue to guide our way forward. But we will, as we've talked about in the last few weeks, look at our data about where events are happening in the province and supplement as needed in areas of concern. Right now, we know some things are risky in areas like Metro Vancouver, where we are seeing increased numbers of cases. This includes group activities indoors, and we have seen this. We've seen this with spin classes in gyms. We've seen this with dance classes inside. We've seen it with activities where we get together now as the weather's getting cooler, where we congregate indoors. So if you know somebody in your social circle with COVID, that means that your risk is higher. If you live with parents or elders, or work in essential services or in healthcare, you need to refrain from these risky activities in these areas right now. As we look to the recent numbers, we're all concerned, and we're watching things closely, and we spent some time out in the Fraser Health region last week to supplement and to support the amazing work that the public health teams are doing there and doing in Vancouver Coastal and in other health authorities around the province. We did anticipate an increase as we moved indoors into the cooler weather, but it is incredibly important that we manage this increase effectively. And I am asking once again for your help to slow the spread of this virus in BC so that we can keep our schools, our businesses, and our communities open and safe. The greatest impact you can make is through those actions, small or big, that each of us takes every day. You can help by staying local, by only spending time with your household, or at most, your safe six, the same group, on a repeated basis, and by following your safety basics at work, at school, and at home. Right now, fewer faces, again, makes for safer spaces. And by staying small, we can ensure that those things that are important to our well-being can continue. If you need some encouragement, look no further than the children and teens who have so quickly adapted to these protective measures, particularly in schools. And I hear from young people all the time, and I appreciate all of the letters and the cards and the notes and the pictures that I get, where they have learned that this is something you can adapt to. You can play sports safely. You can dress up and have fun for Halloween outside in small groups or with your family at home. And young people have shown us that they are adaptable and can get through this storm. We need to use that energy and use that ability to the resilience that we see in young people to make sure that we can do this as a community as well. Let's remember that even though we think we are okay and have no symptoms at all, this virus can still be transmitted. And we need to be aware that our risk and the risk that others bring with us. In most cases, it is transmitted to those that we are closest to, whether it's in our family, whether it's a group of people that we spend time with, or whether it's in our workplace. And what we are seeing now is that this can have a very large ripple effect. It's having a ripple effect, unfortunately, in long-term care homes. And we're starting to see outbreaks again that are moving through long-term care homes. We're seeing it in group settings, particularly in the Lower Mainland, but around this province. And this is the time that we need to step back and go back to our basics. Our individual actions are incredibly important right now. But let's also remember that as the days get darker, there is lightness ahead. We know that we will get through this winter. We will get through the challenges of COVID-19. And we will do this as we have shown that we can do over the last 10 months, each of us doing our part, and by being kind and being calm and being safe. Thank you.